Good afternoon. Thank you for joining the GW Cancer Institute for our webinar on the Comprehensive Cancer Control National Partnership Support for CCC Coalitions. I'm Mandy Pratt-Chapman, Director of the GW Cancer Institute, and this webinar is our third in a series that will focus on providing technical assistance for comprehensive cancer control efforts. Before we get started, I'd like to take a few minutes to go over housekeeping remarks. We ask everyone to keep their phones on mute to avoid any background noise and disruption during the program. Please do not put your phone on hold, as that may result in music that will be disruptive, so please keep your phone on mute. Also, today's program is being recorded. We will use the question and answer feature for this webinar. You'll see the Q&A box at the bottom right hand of your screen. If at any time during the presentation you have a question, please type it in and we'll address it during the question and answer portion at the end of the webinar. The questions are anonymous and I will repeat the question. We'll take questions at the end of the presentation, but please feel free to write questions as you think of them in the Q&A box, and we'll make sure to answer them during the time allotted. We'll also use the chat box feature, which is on the top right side of your screen. You can use that box to interact with each other, but because we'll be talking during the presentation, we may not be able to keep up with the chat. So if you do want a question addressed, please use the Q&A box at the bottom right. As a note before we get started, following this webinar, you'll receive an email with today's presentation recording, a link to join the Research to Reality forum for further discussion, and an evaluation survey to provide feedback, as well as today's slides. The recording will also be archived on our website along with our previous webinars. Before we get started, I wanted to just tell you a little bit about the GW Cancer Institute. We were founded in 2003, and our vision is to set the standard for patient-centered care and eliminate cancer health disparities. We're excited about today's informational webinar on the Comprehensive Cancer Control National Partnership. In September 2013, we were awarded a 5-year cooperative agreement from the CDC to provide technical assistance to enhance comprehensive cancer control efforts. This award is in addition to an award given to the American Cancer Society, and we're coordinating with them to make sure that we're not duplicating efforts and we're helping to support one another. We'll now begin today's presentation. Our presenters will provide an overview of the role of the national partners and a description of the priorities of the national partners in the year ahead. This is our agenda for today's call. First, I will do a brief introduction of the speakers. And then we'll go through what the National Partnership is, the vision, mission, and principles, recent efforts, future directions, and then questions and answers. So here are our speakers for today. Tasha Moses is Director for Strategic Initiatives and Communications at C-Change. Lori Graff is the Comprehensive Cancer Control Program Manager for the American Cancer Society. Ina Wanla serves as the National Partnership Project Lead in the Comprehensive Cancer Control Branch within the Division of Cancer Prevention and Control at CDC. From Strategic Health Concepts, a national consulting company based in Denver, Colorado, we have Karen Homan, the President of Strategic Health Concepts, and Leslie Gibbon, Vice President. Thank you all so much for joining us today. I'd like to now turn the presentation over to Karen.
Great. Hi, everybody. Thanks for joining us, and thank you, Mandy, and thanks to George Washington Cancer Institute for allowing the National Partnership to share today's information on this webinar series. We appreciate it. We'd like to start out today by providing a very brief background on who and what is the National Partnership. So the National Partnership was created in 1999, shortly after CDC established its comprehensive cancer control program at the national level. This really represented, the partnership coming together represented really for the first time organizations that were cancer related but solely focused on comprehensive cancer control, and it still remains the only U.S. partnership that is solely focused on comprehensive cancer control. From the beginning and still to this day, the partnership is really focused on leveraging their organizational resources. By that I mean the individual partner resources, organizational resources, and coordinating those organizational experiences and expertise to support comprehensive cancer control with ultimately the goal to actively build capacity for cancer control throughout the nation. As you can see from this slide here, currently we have 16 national organizations that make up the partnership right now. They are national in scope. They all have cancer somewhere in their realm of focus. They are willing to look at a broader agenda, though, than just their organizational agenda, much like probably happens in your comprehensive cancer control partnerships. Recently, we formed a new leadership group for the national partnership, and you can see the members of that leadership group here. We have a chair who is Shisheko Staples from ACS CAN. Our vice chair is Tasha Moses from C-Change. The CDC representative is Ina Wanless from CDC, as I said. Our convener is the American Cancer Society. The American Cancer Society has been the convener for the national partnership since the inception. And Strategic Health Concepts, Leslie Given and I are the technical consultants to the national partnership. The chair and the vice chair positions will rotate every year. And again, this is something, a new leadership group that was just established in the last meeting that we had in May. So with that very brief introduction, I will turn it over to Ina Wanless, who will talk more about the National Partnership's vision, mission, and principles.
Thanks, Karen, and good afternoon, everyone. Over the next several slides, I will provide a general overview of the Comprehensive Cancer Control National Partnership, including a description of its purpose and contribution. For the remainder of this presentation, I will use CCC National Partners in lieu of the long title. So the overall purpose includes that the CCC National Partnership has a national presence, and through the work of the states, tribes, tribal organizations, territories, and the U.S. Pacific Islands jurisdictions, including the local levels, aim for the reduction of burden of cancer. Additionally, through the coordinated efforts, collaboration, and the partnering members working together on the development and implementation of the cancer control plan, strive to address and reduce the burden of cancer in their communities. The CCC National Partnership offers a collection of resources and various types of technical assistance via its members and includes the offering of nationwide resources and related assistance to the CCC Coalition, coordinating and leveraging of the CCC resources of the CCC national partners, helping to identify issues, opportunities, and providing lessons learned, and lastly, tailoring of its assistance to different types of CCC coalitions. The CCC National Partnership efforts align somewhat with the CCC Coalition. It's more of a quasi-coalition and as such have similarities, including the challenges sometimes experienced by a coalition. The CCC National Partnership has been in place, as Karen mentioned, since 1999 and has been operating on an informal basis since its inception. However, the partnership has grown over the years as well as been adapting to meet the evolving healthcare landscape and priorities. Hence, there has been the increased need to shift in the ways and types of activities to meet the needs. For example, the CCC National Partnership has undergone a change in its operation from an informal to a more formal structure and is looking at ways at assessing the new priority areas. Some of the initial efforts include, as noted on the slide, identifying the CCC National Partners' value-added contribution as well as those for each partnering organization, making a transition to a new formal way of operation, and utilizing a rotating leadership process to administer the CCC National Partnership. Addressing the changing CCC National Partnership priorities as a result of the change and adaptation of the new infrastructure, working to actively engage all partners, identifying gaps in partners, and ensuring that all partners have a meaningful role, and lastly, adapting to meet the challenges of limited resources. Individually, the national partners each provide their own unique contribution to the overall CCC effort, and specifically in the areas of providing, one, technical assistance and training, such as expertise provided by the NCI's Planet webinar series on evidence-based intervention and sea changes support of the CCC Leadership Institute, as well as NASAR's Cancer Surveillance Institute. They also provide advocacy support, such as NACCD and ACS's CANS through the various legislative and policy initiatives. The third area along resources, such as funding provided by CDC through the various cooperative agreements referenced earlier, as well as others, to states, tribes, and territories to support infrastructure needed to sustain CCC efforts. And lastly, expertise and leadership, such as the Commission on Cancer State Liaison Program, the Live Strong Cancer Survivorship Initiative, and NATO's local level support for CCC, and the Intercultural Cancer Council's expertise in addressing cancer disparities. Lastly, to guide the overall effort of the Comprehensive Cancer Control National Partners efforts, we have developed a strategic plan, and the plan goals are provided here, referenced on this slide. It includes facilitating and providing support to the CCC Coalition and coordinating national CCC efforts. As the CCC national partners move forward with efforts, the plan will be adjusted as needed to meet the activities and priorities of the partnership. This completes my presentation, and I thank you for your attention. Now Lori Graff will present on the CCC's national partners' recent efforts. Thank you.
Thank you, Ina, and good afternoon, everyone. So far we've shared with you the National Partners' vision, mission, and strategic plan goals. Now I'm going to take a few minutes to talk about specific initiatives that have been or are being implemented by the partners. And these initiatives are based on the goals of the strategic plan and designed to help achieve the mission of the partnership. And there are two categories of initiatives. The first are those sponsored by the national partners, and the second category are initiatives that are led by specific members of the partnership. I'm going to begin by sharing information about the initiative of the national partners. The first one listed on the slide is the 9 Habits workshops. Over a year's time, 3 workshops were held. 68 coalitions sent teams to the workshop, which translated into 270 coalition members in attendance. And the workshop focused on the 9 key habits of a comprehensive cancer coalition, and those habits are shown on the right side of the slide. The events were interactive, they provided tools and resources, and also allotted time for planning sessions. So as a result, at the end of a workshop, each coalition team left with an action plan in hand. And due to the overwhelming positive response of the workshop, the national partners decided to adapt the workshop materials and tools and create a resource that can be accessed online. And those materials will be available this fall on the partners' website and the websites of our partner organizations. Moving on to the second initiative, beginning in 2013, selected subject matter experts from the national partners were convened to form site visit teams and provide technical assistance to 7 of the 13 programs funded by CDC to participate in the Policy, Systems, and Environmental Changes Demonstration Project. And the goal of the TA is to enhance the capacity of the programs to implement their PSE policy agendas and media plans and to conduct evaluations. And through the site visits, assistance was provided around such PSE issues as patient navigation reimbursement, tobacco tax, the Accountable Care Act, member engagement, and the Cancer and Obesity Link. And using what has been learned through the TA visits, work is currently underway to develop a PSE toolkit for comp cancer programs and coalitions. And in addition, 4 PSA mini webinars are being planned, and they'll address such topics as PSA framework, creating a PSE task force, developing a policy agenda, and direct action organizing. And both the toolkit and the mini webinars should be available prior to the end of this year. The third national partner-led initiative is the 5-year Outcomes White Paper. And a stakeholder group has been convened to prepare a white paper that's really going to document the outcomes, 5-year outcomes of the technical assistance visits that have been made to cancer coalitions. And the paper will include a table of accomplishments, evaluation data, and a framework for a technical assistance model. And again, this document will be completed by the end of the year. And if you copy and paste into your browser the last initiative listed on the slide, you'll be taken to the National Partners website. And this website was designed by our communications work group, and it's a public website that provides information about the partnership and is really considered a portal. And from the portal, you can access tools and resources and news that's available from the various members of the national partners. And the website is maintained by the communications work group. And as of July of this year, our colleagues from George Washington Cancer Institute, who are members of the work group, assumed responsibility for this site. The next slide addresses member-led initiatives that have been implemented over the past year. And the first listed is the Comp Cancer Coalition Technical Assistance Visits. And these TA visits started in 2013, and they're going to continue through the end of this calendar year. In 2013, 2 national partners, C-Change and the American College of Surgeons Commission on Cancer, worked together to establish and implement really a successful strategy of identifying coalitions that could use some help and providing what was termed as a TA package. And assistance was provided to 4 coalitions, and the evaluations that have been conducted to date indicate positive impacts and outcomes as a result of those site visits. This current year, technical assistance site visits are being made available through a cooperative agreement between the American Cancer Society and CDC, and with additional support from C-Change and the American College of Surgeons. And there's 2 kinds of TA being provided to coalitions: operation and functional, and colorectal cancer screening systems changes. The operations and functional technical assistance is basically working with cancer coalitions who would like help with processes and procedures. And examples of this kind of TA include such things as clarifying the roles and responsibilities of the coalition leadership and members, re-engaging and maintaining partners, updating a cancer plan, or selecting priorities for cancer from the cancer plan for implementation. And as I mentioned before, the second type of technical assistance relates to helping with colorectal cancer screening. Through an application process, 2 comp cancer programs and their coalitions have been selected to receive technical assistance to help facilitate the development and the implementation of colorectal cancer screening system changes as a way to help increase screening rates. And this TA is in support of a national effort, which I'm sure you're all familiar with by now, and that's to achieve an 80% screening rate for colorectal cancer by the year 2018. The second member-led initiative relates to webinars. And 2 national partners, Legacy for Longer Healthier Lives and C-Change, collaborated to present 3 webinars. 2 of them focused on tobacco, specifically tobacco policies and cessation services, and the third, as shown on the screen, addressed the correlation between obesity and cancer. And the last member-led initiative I want to address today is Research to Reality. Sponsored by the National Cancer Institute, R2R is an online community of practice that is both an information resource and a forum. And through the forum, public health professionals can ask questions, discuss ideas and solutions, they can share resources and tools, and participate in cyber seminars. And if you haven't been to the Research to Reality website, I encourage you to do so and really explore what is available. So now that I've shared some information about the National Partner Initiatives, We would really be interested in learning if your Comp Cancer program and coalition or coalition have participated in any of them. So we have a poll question for you. And the poll question is, in which of these Comp Cancer National Partner Initiatives have you participated? Did you or someone from your program or coalition attend the 9 Habits workshop? Have you been involved in any of the coalition TA visits? Have you gone to our national partners website? Or are you aware of the Research to Reality website? Have you participated in any cyber seminars? You're not sure? Or really you haven't had an opportunity to really participate in any. So we'll leave the poll open for just a minute. And Monique, will we be showing the results of this?
Yes, I'm broadcasting the results right now.
Okay, great. As you can see, our colleagues at the National Cancer Institute will be very pleased. I see that many of you are familiar with Research to Reality, so that's great. Many of you were able to attend the 9 Habits workshops and the national partner websites. A little over a third of you who responded to the survey are familiar with that website. So all of this really helps us, again, as we think about our strategic plan and see how this correlates with our goals and objectives for the upcoming year. So thank you, everyone, for participating in this survey. And now I will turn the slides over to Tasha Moses from C-Change.
Thanks, Lori. Over the next few slides, I'm going to talk about the CCCMP's future directions and what we've chosen as priority areas to work on within the coming years. So for the 2014 to 2015 years, we've decided to focus on the following areas. Similar to comprehensive cancer control coalitions, we have to focus our efforts and energy. And in order to do so, we came up with the following decision-making criteria. So the first is that CCCMP can provide value-added contributions to the area. The second is that we have the capacity to actually carry out the efforts in a particular area. The third is that the timing for addressing the focus area is supported by political and organizational stakeholders. And the fourth, that there are measures of success that can be identified and tracked for the area. Keeping those criteria in mind, we decided that we would focus, help coalitions focus their efforts on the following. The first is to increase the uptake of HPV immunizations. The second is to increase tobacco cessation services provided to cancer survivors. And the third is to increase colorectal cancer screening rates to 80% by 2018. If you notice that all three of these initiatives that we have decided to focus on match up with a lot of national initiatives that are currently going on. In terms of our role as a national partnership in these priority areas, our roles will include the following. The first is coordinating the CCCMP member communication about the priority areas. This includes the following: sharing information about member resources and events, and streamlining communication to the CCC coalitions. We will also coordinate CCCMP member data collection efforts to reduce duplication of requests for information through mechanisms such as needs assessment surveys and interviews, and streamline CCCMP member requests for information and data from the coalitions. When appropriate, share results of data collection with all CCCMP members for the purpose of informing, educating, and improving CCCMP efforts. We'll also simplify access to priority area resources, such as current CCCMP member initiatives and opportunities, printed materials, guides and toolkits, and various types of technical assistance available. We'll communicate focused one-voice messages and calls to action on key issues within the priority area to CCC coalitions. And we'll identify evidence-based interventions and best practices within the priority area to share with CCC coalitions. Work groups have been formed in each of these areas in order to help carry out the established priorities. I will now turn it over to, next steps in terms of the priority areas assessment. We're going to do a CCC data collection to decide what is being done related to needs assessments, success stories, and repository of information collected. The CCC Coalition Technical Assistance, what technical assistance is being offered so that we can figure out where the gaps are and what more needs to be done. Written resources for CCC coalitions, what is available in the priority areas in terms of white papers, guides, and toolkits, and CCC coalition communications, what communication methods are being used to communicate to coalitions such as newsletters, websites, emails, listservs, etc. With that, I'll turn it over to Leslie Given with Strategic Health Concepts, who is going to launch a poll.
Thanks, Tasha. Thanks for going through the steps that the National Partnership will take to get those focus area, 3 focus area work groups off the ground. The assessment that Tasha went through will help the National Partnership to understand what's currently available to you all as comprehensive cancer control programs and coalitions. It will help us understand what the opportunities are to coordinate and collect across the National Partnership members, and also maybe even outside of the National Partnership, are there organizations that we could work with that could help you all as well. We'll identify, are there gaps in this area? And also we're going to ask ourselves, are there organizations who are missing from the National Partnership who could be brought in either as a member in some kind of a partnership role to help you all in these 3 areas. So this is very much like what you do as coalitions when you choose priorities out of your cancer plan and you decide to make sure that form follows function. You set up your coalition with work groups to address those priorities, and then you look around and see who's missing. Who do you need to bring to the table? So the National Partnership is going to do the same thing. And then also, like you, we will have each of these priority work groups develop an action plan, essentially, that says, okay, given all of these results, given what we know as national partners for what could be done, what we can actually do together, this is what we're going to do. We're going to step forward and do something in terms of HPV vaccination uptake, in terms of increasing colorectal cancer screening, and also assisting coalitions with increasing tobacco cessation services for cancer survivors. So that's what we're going to be doing over the next couple of years. And we do have another poll that we wanted to just get a quick pulse from you all and find out which of these areas is most interesting to your Comprehensive Cancer Control Coalition. So we've got the poll open. You guys can choose which area is most interesting to you. Give it a few seconds here. So clearly a lot of folks are interested in colorectal cancer screening. That's no surprise there. We know that the National Colorectal Cancer Roundtable's 80 by 2018 initiative has really drawn a lot of attention. And a lot of you all as Comprehensive Cancer Control Coalitions are already involved in increasing colorectal cancer screening, particularly since not every state, tribe, or territory has the funding from CDC to actually implement a screening program. So you've been filling the gap there, and of course with a national call to action around HPV vaccination that's been given, we can see that a lot of folks are interested in that as well. So thank you for responding to those questions. Appreciate it. So next we're going to actually turn it over to Mandy for leading us through Q&A. And I think now is the time for you guys to post your questions up there. And I just want to say thank you as we work through these slides. There'll actually be a slide here that you can contact the National Partnership and get in touch with us. I would also just mention, and I know, Mandy, you'll mention this too, that the R2R discussion that will happen after this webinar, if you all have ideas about those 3 priority areas and what you think the National Partnership can do to help your coalition in those 3 areas, please start a discussion or answer our questions on R2R, and let's see how we can help you all. Thanks.
Great. Thank you so much, Leslie. I want to open it up for questions now. No one has actually typed any questions so far, so if you do have a question, please go ahead and enter it now so that we can ask it. So for those people who are interested in the 80 by 18 initiative, what's the best way for them to interact with the national partners or get more information about that? That was the highest interest rate. Would that be through Todd?
Yeah, I think Mandy for now. So go ahead, Karen.
I was just going to say, so as you saw in some of those slides, is that the National Partnership is currently determining what exists in each of those priority areas and then what its kind of value-added contribution can be in those areas. So part of that assessment will be, of course, looking what's out there, as well as we would love to hear from folks what they feel is missing or what value-added contributions the National Partnership can provide to that area. So absolutely the best way to, and you'll see in a slide or two, the best way to get a hold of the National Partnership is through Todd Tyler, who works with ACS. But we would love to hear what people feel is missing out there as we begin determining what actions and efforts to take in each of these 3 areas.
Great. So when Todd Tyler's information pops up, for those of you who are interested, please provide your feedback on what you would like to see there and what's missing. I do have a question. If the comprehensive cancer control programs or coalition's priorities do not match the National Partnership priorities, are there still opportunities for TA? And I guess I will turn it over to the speakers that also might contribute to answering that question. Would anyone like to take a go at that?
Well, this is Leslie. I'll start, but anybody else, please jump in. I think it's a great question, and you know, it's okay if your priorities don't match up with the national partner priorities at the moment. I'm sure that there'll be opportunities like Lori was talking about earlier. For example, if your coalition is working on policy system environmental change efforts, Lori mentioned the fact that there'll be some webinars and a toolkit coming out, so that's an opportunity. You know, these are, just like your coalition, these are the priorities the National Partnership has identified, and this is where the bulk of our work is going to be. But we'll, you know, each individual organization continues to offer what they offer. So it may be that Legacy does something outside of tobacco cessation, and so we'll make sure as national partners if you have the opportunity to tap into that resource. For example, you know, there are other things that happen through national partner members, like NACDD offers mentoring opportunities. So there are lots of different ways, I think, that the national partnership individually, their members will be able to help with some of your requests. And then, of course, GW is going to be offering a lot of technical assistance as well in different areas.
And I think this is Karen. I think that another thing to think about is that technical assistance happens in lots of different ways. It can happen through webinars, one-on-one assistance, toolkits, that kind of thing. And so there are a lot of existing materials and soon-to-be materials like the 9 habits of successful cancer coalitions will soon be out in a toolkit kind of format. So in addition to those individual opportunities that Leslie just mentioned, there are existing and soon-to-be new technical assistance offerings that are not necessarily in those three areas.
And this is Tasha Moses with Sea Change. I also want to echo what Karen and Leslie mentioned, but also say that if there is a particular type of technical assistance that coalitions are looking for, I highly encourage you to go onto the CCC National Partners website or reach out to Todd Tyler to mention what that particular technical assistance is, because again, we need to hear from you. Oftentimes we are trying to figure out what's going on in the field and what the need is, but that it makes our job easier when you actually give us feedback and provide us information on where some of those gaps may be, because something that your coalition is looking to do or needs assistance on, other coalitions may also need assistance on. And if we hear that there are several coalitions that have this need, there may either be a current resource available or something that we could look into either the national partnership as a whole providing or one of the individual partners providing.
Great. And just to jump in there, Leslie did mention this, but both GW and ACS are providing technical assistance as well. I did have a specific question related to the TA visits, but before I jump into that, I will say that we're trying to be responsive at GW to needs as they arise, and one of the things that recently came up from the program director meeting was an interest in survivorship, and so we're going to actually be piloting a survivorship special interest group to try to connect individuals who might have questions related to that priority, given that strategies seem to be lower in terms of volume for the programs for that CDC priority, and we'll continue to try to create TA efforts that resonate with what the needs are that are mentioned. Another question that came up that maybe Lori can answer from a participant, are the site visits, TA visits for coalitions still available, or was that a review of what's been done in the past?
Hi, this is Lori, and yes, that's a review of what's been done in the past and what's currently going on. As far as the operational and functional site visits, we do have 2 coalitions selected, and we will be working with them till the end of the year, as well as the colorectal cancer systems changes TA visits, and we have 2 coalitions and comp cancer programs that we'll be providing assistance to. But I just want to reiterate what both Karen and Tasha said. The TA may not be a site visit, but it comes in many forms, as Karen indicated, the webinars, the toolkits. And also Tasha mentioned that if you find a need for a technical assistance, if you're seeing a gap, if you see that there's anything value added that our national partners can provide, please let us know by contacting Todd, who will then in turn let the national partners know.
Wonderful. I think those are all the questions I have in queue. If anybody has any other questions, go ahead and type it right now, and I'll just wait for a second. I think all the questions have been answered. It looks like no one has any additional questions. So with that, I want to thank everybody who joined us today on the call. Hold on one second. There may be one additional question. In terms of who to contact about the survivorship interest group, you can go ahead and contact cancercontrol@gwu.edu, and we'll respond to that. We're setting that up. So I think that is the final question. I'm going to go ahead and show you the contact information. So this is where you can reach us. You can contact us by going to cancercontrol@gwu.edu to provide us with more information or questions or sign up for the special interest group. And I wanted to also remind you that we will be having a webinar on September 25th at 1 p.m. about enhancing cancer program partnerships with the area health education centers, the AHECs. And I also wanted to remind you again that following this webinar, you'll receive an email with today's presentation recording, a link to the Research to Reality Forum for further discussion, an evaluation survey, and today's slides. So, and I think I inadvertently went that too quickly. So this is Todd's information. If you want to go to the National Partners website or contact Todd specifically about TA needs, then I wanted to make sure you have an opportunity to write down that information, but these slides will be sent out to you as well. So with that, I want to thank you all for joining us today. I want to thank our wonderful presenters for coordinating a great overview and a coordinated effort for the National Partnership, and I will give you back your day. Thank you so much.